quite a statement by Montgomery County Sheriff Phil Plummer, who tells us that nothing has worked to stop the heroin problem in the Miami Valley,
despite dozens of efforts by county officials. So 2 News reporter Mayton Levy getting answers in a story you'll see only on 2.
Sheriff Plummer considers 4 overdoses in just one day low. Tonight he's calling out county leaders. I took those concerns to officials who told me there's no perfect solution.
Already this year, the Montgomery County Sheriff's Office has responded to 530 overdose calls. Sheriff Phil Plummer says it's repeat users headed back to jail.
And arresting them is not solving the problem. It's just a revolving door.
Plummer says 50% of the jail population is behind bars for drugs. The other half for violent crimes, desperate for drug money, like assaults and thefts. A problem he says can only be fixed through treating addiction, a solution he believes is not being tackled.
$20 million of taxpayer money goes into the jail. And let's get those people into social service programs.
There are 7 treatment facilities in the county. County official Jody Long tells me tax dollars pay for one of those facilities, Nova Behavioral Health.
How many treatment beds or program services does the county fund right now?
In terms of access to subacute detox and residential, we fund 71.5 beds per fiscal year. In addition to that, we provide multiple outpatient services to individuals through our contract providers.
Sheriff Plummer tells me that's not enough.
So if they say we have enough treatment, why do we have 166 overdoses in March? If we had enough treatment, they wouldn't be dropping left and right in the streets.
I crunched the numbers. There are 781 treatment beds in the county, but availability depends on things like insurance coverage, whether you're a veteran or disabled. Long says Adamus is working on fixing that.
Right now, we are looking at ways to create immediate access to treatment.
Long adds not everyone is always willing to get treatment. For Plummer, that's not an excuse.
I mean, I'm to the point now where we're going to take our data and go in front of that board and explain to them what we're seeing. But I shouldn't have to do that. Their job is to find out what's working and what's not working. I mean, my job is to investigate you and arrest you and incarcerate you and, take care of you in the jail.
Long admits this is one of the deadliest drug epidemics the county has ever seen.
Why do you think there's been so many conversations across the board that have not worked?
I think every community partner is using all of their resources to identify ways to come around this, and yet it's such widespread.
Again, that's 781 beds in the county. I made a list filled with numbers and availability to those facilities. You can find that right now on Wdtn.com. Mayton Levy, 2 News, working for you.
Now, the latest on the heroin and opioid epidemic here in the Miami Valley, which is costing much more than just human lives.
A 2 News investigation finds millions of your local tax dollars going to fight it every year. Natalie Tendall with 2 News investigates, breaking down the numbers.
Well, in the last 2 years, the amount of money our community spends on fighting heroin and opioids has gone up more than $3 million. Those at the forefront of this fight say it's a problem all of us are paying for, so it's time to step up and do something about it.
911, what's the address of the emergency?
It's an overdose. There's a syringe. My boyfriend's father has OD'd or something. He's barely breathing. He's gasping for air.
My guess is drugs. Overdose.
The war on drugs in our community is expensive.
It's affecting the job force. It's affecting the health and well-being of our neighbors and our families. And we need to get this epidemic under control.
Heroin and opioid addictions are costing us emotionally and physically, but also financially.
The heroin epidemic is taking a third of the Adamus budget, and it's serving only 8% of our clients.
The amount of money being spent on the problem is going up, but it's not getting better.
But when we look at the accidental drug overdoses and how they affect folks' lives, we're losing that battle as far as I'm concerned.
Departments like the Montgomery County Coroner's Office are strapped. Director Ken Betts tells 2 News investigates they're constantly at capacity and are spending more money than ever before on outside testing because of concoctions of new drugs people are taking and dying from.
It takes a lot of time and effort and instrumentation in the laboratory to identify the substances that contributed to the death of the individual.
With no new money coming in from the county, they're exhausting every resource and staff member they have to take care of the skyrocketing amount of overdose deaths they see every week.
Our staff is plain burned out.
ADAMIS, or the Alcohol, Drug Addiction, Mental Health Services of Montgomery County, is also spending a lot of time and effort on the problem. Spokeswoman Ann Stevens says they're spending funds on education and treating those impacted by heroin and opioids, but they can't devote their entire budget to the issue.
We still have to help the mentally ill. There are other people who have addiction problems that don't involve heroin.
So let's talk money. 2 News Investigates obtained numbers from departments across the Miami Valley, and this is what we found. The coroner's office spends approximately $3,500 for the average overdose death they process, and they're on track to spend about $1.3 million this year. ADAMIS is spending money on treatment centers, drug overdose reversal kits, and advertising and education. Their total price tag is about $7.2 million. The Montgomery County Public Health Department has everything from prevention services to a poison death review, which collects data that tells community leaders how bad the problem is. This department is spending an estimated $1.5 million. And finally, law enforcement departments across the community are also spending resources on overtime, advertising, and special training. The Montgomery County Sheriff's Office is spending more than $700,000 this year. That's a total of more than $10 million, a price tag those fighting this problem say is worth it.
If we didn't have these tax dollars to help with the epidemic, a lot more people would be dying.
But these funds only go so far.
We all live in this community, and we all bear some responsibility of what happens here.
So what can you do to help? Those at ADAMIS say it's all about public awareness. They say people should be talking to their kids about drugs. They also say it's changing the mentality in our country that you need to take a drug for pain management. Natalie Tendall, 2 News Investigates.
More Ohio pharmacies are joining in the fight against heroin. To date, 1,000 pharmacies now offer the opioid overdose antidote, Narcan, without a prescription. 2 News reporter Jordan Bowen is asking one of those pharmacies about the demand they're seeing.
Well, 79 counties now have Narcan available to patients without a prescription. That's almost 90% of the state. Heartland Pharmacy just started carrying Narcan, also known as naloxone, 6 months ago. That's when Governor Kasich signed a bill allowing pharmacies to dispense the drug without a prescription. Before then, owner Kindy Gusson says in his 20 years of experience, he never got one single request for the drug. Within the first month, he got 3 requests. Many were loved ones of heroin users who he says wanted to be prepared. Gusson decided to carry the drug because he wanted to do his part to fight the heroin epidemic.
It is sad that I have to carry stuff like naloxone in order to save lives because people are abusing left and right. But this is the fact that we have an overprescribing habit of narcotics.
And Narcan is available in both needle and nasal form. For a full list of pharmacies that offer the drug without a prescription, you can find this story on our website, Wdtn.com. Jordan Bowen, 5 on 2.
Local business owners tell us they have plenty of jobs to fill, but they can't hire anyone due to one problem, and you're going to be surprised to learn what it is. 2 News reporter Maytal Levy digging deeper and tells us how the heroin epidemic is impacting hiring.
I spoke to 3 business managers in the area. All tell me 70% of their applicants get turned away due to failing drug tests. The decrease in productivity is hurting their bottom line.
5 days a week, Jeff Stokes does mechanic work from replacing brakes to restoring transmissions.
I'm a one-man shop.
Jobs most car shops would require 2 to 3 man crews. Stokes says he doesn't trust anyone else to do the work.
Most of your younger generation seem to have some kind of substance abuse problem.
Mark Anderson with Montgomery County Workforce Development says there is a rise in applicants not being able to pass a drug test.
The drug issue in general, from an employment standpoint, more and more people are failing the drug test when they go to get hired. And it is becoming, you know, what you would call an epidemic in hiring as well.
Positive heroin drug tests in the workplace have risen by 82% from 2010 to 2013, a problem that isn't just impacting the user, but employers like Stokes.
It's costing our employers opportunities to hire people, which, right now we're at 4.5% unemployment, so it's not like there's millions of people ready to step into the new jobs.
Another concern is accidents or overdosing on the job. Stokes hopes things change soon, so he won't have to worry about trusting who he hires.
Showing up late, not showing up at all. Productivity is down dramatically.
The county does have programs in place. For a list of treatment facilities, look for this story on WDTN.com if you know anyone or you yourself are dealing with addiction. Maytal Levy, 5 on 2.
Soaring numbers of overdose deaths are adding to the already high caseload of our local coroner. 2 News reporter Charlie Gordon is digging deeper to find out how this may cause some delays.
The number of cases the Montgomery County coroner and medical examiners are handling have increased over 60% this year. They say that number is not letting up anytime soon.
I think this is the starting point, and it's only going to get worse.
Ken Harshberger is the Montgomery County coroner. He's worked in forensic pathology for 15 years, and since then he's seen a steady increase in cases, partly because Montgomery County is a referral center where other coroners send their autopsy exams here, but more so because of the spike in overdoses.
I've actually been brought in some part-time folks that have picked up a lot of the extra caseload. In the last 2 or 3 years, we've jumped up probably 200 cases a year. And just as an example, 250 is considered a full-time caseload for a forensic pathologist. So every year I've needed a new pathologist to work.
Besides homicides and questionable child deaths, his office does autopsies on the majority of overdose cases in the Miami Valley. He says they take in approximately 30 overdose cases a month because of heroin and especially fentanyl.
This last year we finished at 259. We'll be near 400 at the pace we're on just for Montgomery County.
Too few pathologists and a wide variety of new street drugs also means that family members must wait longer for death certificates and potentially delaying insurance payouts.
With the increase in the laboratory work we have to do for toxicology, and then all the unique products that are on the street now, are taking us a lot longer to rule on some of the cases. Most of our cases still go out within 4 to 6 weeks, but there are the unique ones where our tox lab takes a bit longer to identify what's in the blood. But those are taking maybe 6 to 8 weeks now.
A local doctor is blaming some of his colleagues for the heroin epidemic. He says he has a plan to stop a drug problem that no one has been able to slow down to this point. News reporter Maytal Levy is asking questions about where it all starts.
Dr. Luis Tellez at St. Elizabeth's helps 100 patients dealing with opiate addiction. He says one of the region's biggest challenges, his own colleagues overprescribing pain medicine like Wdtn and Oxycontin.
I'm really grateful to be alive.
This tattoo of an angel on her arm is a reminder of that. She started using heroin 10 years ago.
I started breaking laws. I've been to prison 3 times.
Her mother and boyfriend both died from overdoses. Her father died after using a dirty needle.
It numbed me, it numbed the pain.
Now at 35, she's turning her life around, hoping to build relationships with her 2 daughters she lost contact with. Her doctor, Luis Tellez, says the problem keeps getting worse.
We are seeing more and more and more.
Something hard to acknowledge for Dr. Tellez. He says much of the problem stems from doctors overprescribing painkillers.
Unfortunately, there are still problems. Most of the drugs that folks get addicted to are unfortunately prescribed by physicians.
80% of new heroin users start off using pain pills, which contain the same type of base ingredients as heroin.
They seek it for the pain control at first, but then they seek a high.
Another disturbing statistic, 91% of people who survive an overdose are still able to get a different opioid prescription. One medication Dr. Tellez's patients say is helping them beat addiction, Vivitrol, a shot that fights heroin cravings.
I think it's great. I don't even think about using.
She's 7 months clean and plans on living her life for the people she's lost.
I'm happy. You know, I see changes every day.
Dr. Tellez says it's not too late to fix the problem, but his colleagues need to stop freely prescribing painkillers. Maytal Levy, 2 News, working for you.